Right now, we are getting fresh reports from our field epidemiology training program. Our epidemiologists are down there doing the investigations. Yes, we confirm that there are over 160 cases so far, starting during the first week of May up to June 13. The investigation showed that many cases were children, at least half of them, and that they presented with fever, cough, and because COVID-19 was ruled out, we are now looking at influenza, another virus that mimics COVID-19. And so we have provided information to the community through our investigation team and, of course, the local health officials. And tomorrow there will be a briefing so that things will be clearer and that interventions, as you mentioned, masks and reporting when you're sick and drinking fluids will help if this is flu. And for the elder persons, because they're also getting sick, should get their influenza vaccination.
Right, Dr. Eric, cases of the flu or flu-like illnesses have been going up. Grabe rin yung jump from last year. Should we take it to mean that we're coming off of a low baseline because last year mobility was not as free as it is this year? Would it be that? Because when we were just all stuck at home, hindi naman tayo masyado nagkakahawaan. Or is this brought on by the rains or the hot weather?
That can be one of the reasons, but of course we know that in the Philippines, the month of June is the beginning of the influenza season in the country. During the rainy months, it's not only influenza that we should care about. We have the wild diseases, W for waterborne diseases, I for influenza, L for leptospirosis, and D for dengue. For what's happening there in Mindanao and the other areas, we have alerted local health officials that they have to report as soon as possible because we are on a global alert of a possible pandemic from new strains of the influenza virus. As soon as we get the laboratory confirmation, we are going to provide you with details. This has been reported already to Secretary Ted Herbosa, who is looking closely at what is happening there in at least one barangay, Barangay Ned, in Lake Sebu in South Cotabato.
Hey, Undersecretary, like we talked about when the show started, iba-iba po yung epekto sa amin ng COVID-19 pandemic. Like for one, I forgot about my flu shot. She is taking her flu shot because of the pandemic. Is there anything in the data that talks about the effects now of the COVID-19 pandemic on immunization rates on the Filipinos? Dahil po ba yung carry-over po nun, meron po ba tayong nakikitang trend?
Gretchen, bago pa mag-pandemic, bumaba na yung immunization rates natin at lalong naapektuhan ngayong pandemic. Kaya nga hanggang ngayon, nagsasagawa kami ng catch-up, measles, rubella at bivalent oral polio vaccination na matatapos po bukas. In-extend na namin yan ng 2 weeks. Sumampan na sa halos 85% ang national coverage natin. Subalit gusto natin tumaas pa yan, 90%. At nagpapasalamat kami sa mga local government na nakapaghabol. May nababalitaan kami, maraming lugar na over 100% ang kanilang vaccination coverage. Subalit may mga lugar na naiiwan pa rin, kaya tinitingnan namin mabuti anong mga kadahilanan nito. Libre po yung binigay namin measles rubella vaccine. At siya nga nakikita natin, sana manumbalik po yung sigla. Yung mga nanay po dyan, dali nyo po sa health center. Huwag kayong mag-atubili sapagkat libre ang gamot at marami po tayong supply. Maliban dyan, sa isang linggo, ay yung bivalent COVID vaccine, yung pinakabagong version ng COVID vaccine ay ilo-launch na po ng Department of Health. Mauna yung health workers at mga senior citizen veteran. Tama ka, ngayong pandemic ay naapektuhan talaga yung vaccine coverage. So nagka-catch up po tayo at mabuti naman ng mga pamahalang lokal, mga mayor, governor ay nakikisa po sa kagawa ng kalusugan. Yung ibang ahensya po ay tumutulong na din sa amin, pati po yung sa private sector. Maraming salamat po sa inyo.
Usec, just very quickly, one last question. You mentioned Secretary Urbosa na rin. I might take the chance to ask you whether you've had a briefing with him and do you know what his priorities will be moving forward?
Yes, he has a slogan. It's fast, action-oriented, and responsive. This is FAR. His priorities are those that the president has already discussed with him, and this includes the HIV situation in the country where young adults are being reported to be in increasing numbers in terms of HIV infection or AIDS. And then there is tuberculosis, where the Philippines ranks 4 globally in terms of the highest number of cases that are being detected or reported. And then there is the primary care services that is being focused now because of the Universal Care Act, because we better prevent these diseases rather than take care of them when it is very costly when these patients find themselves in hospitals. Of course, the secretary also has already announced digital transformation in the health sector, beginning with the Department of Health. And he already assigned me a task as the Chief Information Officer to carry out the activities that will lead to the achievement of a digital transformation.
All right,
So
perfect.
we are into digitalization, and
Right.
changing the culture in the Department of Health.